Thank you very much. It's very hard sometimes. This is the best part of the whole day, is when you can meet with your friends and have a talk. So many people I haven't seen for a very long time. We are going to have an opportunity now for you to ask any one of the speakers a question. All we ask of you is that you speak loudly. We only have this little cluster of microphones up here. So if you would say your name and try to name the person that your question is addressed to. So we will take questions now for the next 10 minutes for our panel up here. So who wants to start? Yes, Peter.
Do I come up or do I speak from here?
You can speak from there.
I think I can hear you, so you might be okay. Your teacher voice, please.
I wanted to ask a question that came to me because of appreciating the history of human services in Edmonton. In the 1940s, there was a decision made to form the Edmonton Social Planning Council. And one of the issues was there was a discovery that many of the organizations were serving the same clients. And in hearing the various presentations, I was very interested in knowing if you're finding overlap between clients. I had this image from my reading on the past that often people would discover that there was 5 other agencies were supporting the same person or the same family, but nobody knew anything about the others.
Okay. So I'll find out who wants to volunteer to answer Peter's question.
So I thought Cheryl might be able to answer some of that because you're doing some of that work around the cases. And I was thinking
Would you believe we have 3 people who want to answer that question?
So yeah, from an evaluation perspective,
Mike.
From an evaluation perspective, we saw that issue at the very beginning of our multi-agency project. And so we looked at ways of how are we going to keep track of this. What that is called is a shared kind of measurement challenge. And it's one of the things that we, in all honesty, didn't do very well because we didn't have a lot of lead-in time to set some of those things up before we all started implementing programming. However, why I thought some of these other project leads would be great at speaking to that is because despite the fact that we didn't have, a tracking system all designed ahead of time, we have made it work in the sense of people setting up collaborative relationships and trusting kind of systems and sharing those clients in a very client-focused way, not in a kind of structural evaluation tracking type of way. Sure.
So part of the success then is because of the collaboration. And so we know in doing that, we are working with the same client. So if one of the SAGE staff within the hoarding program is working with a client of Greater Edmonton Foundation, the benefit is that we can set out the parameters, we can work around helping that client to set their goals, but then we can actually hand it off to the staff of GEF who can do the follow-up with that piece. We can continue to help with complexities. GEF can take over. We can begin to work with other cases. So same with rides. We know that some of the clients have needed rides and transportation, so they might need transportation to go to the group with the Mennonite Center. So it would be that same client in that way. I can tell you that I don't believe any of the other programs are working in depth with the complex cases we're working with, that's for certain, though in that same complexities, but we do collaborate for their needs.
I'd just like to add a couple of points. I'm not sure that overlap and serving the same client is necessarily a bad thing. Agencies provide different services, and oftentimes, as we've seen frequently with the PEGASIS initiative, clients need different services, different layers of services. There are different complexities of problems and issues. There are many, many organizations across Edmonton that are involved in this work. There is not one single organization that is able to provide all things to all people. And I think that's probably to all of our benefit. The challenge that we've had over the last 3 years, and I would venture to say that we've all had over our working careers, is understanding how to communicate, how to share data in a positive way, in a constructive way, to reduce the frequency with which people fall through the cracks. We all provide these great services. We catch most of the people, but we don't, unfortunately, catch everybody. And so that's what a lot of the work has been that we've done for the last 3 years, and I know many of you have been doing for a lot longer than 3 years, and it's what we hope to be able to pull out of the work that we've done and expand over the next 3 to 5 years.
Thank you. Was that helpful, Peter? Okay. Any other questions? Anne.
I would be interested just to hear a little bit about the strategies people have used for case finding, because it seems that's such a vital piece for reaching an isolated senior is how do you find them?
I think Bernice is going to take that.
So we had done actually a research paper and a project prior to PEGASIS on how to find isolated seniors. And so we used that document to lead our process. We knew that people connect with their physicians, people connect with their pharmacies, they may be seen by their neighbors, they may be seen at the public library. So within the first 6 months, our staff did numerous presentations. We developed materials through Edmonton Seniors Coordinating Council about how to help people connect and how to help community recognize isolation when they see it. So we did numerous presentations to people in the community, from social workers at hospitals to, as I say, libraries, pharmacies, banks, all of the places that a senior might go, even if they might be isolated because they have to go. Grocery stores. So we did a number of presentations to help recognize it so that folks would know how to identify it and then perhaps what to do or where to refer.
Any other commenters? Okay.
I'd like to add. I'd like to add that one other really important component of finding isolated seniors is networking with community. So that could be a neighborhood, that could be a cultural community, it could be a religious community, even an interest like bowling. I don't know, but finding the people who are out in the community, getting to know them, and then discovering who is in their life that is isolated, is another way that you achieve the result that you're looking for. So for within immigrant serving communities, you have to find the people who are the gatekeeper to the community, the people who know that so-and-so brought their mom over from wherever, and we haven't seen mom out. Where's mom? What's mom doing? So that's that relational piece that is so integral to being able to reach those isolated folks who may not go out to the doctor, who may not go to the bank because they actually don't need to. So there's a little bit of a difference too there, where not everybody who's isolated has reason to leave their house. So we have to be even more creative sometimes in how to access those folks. Thanks.
Thanks.
And I'm glad Bernice mentioned the healthcare side, because that was a really interesting piece. As a healthcare organization in this collaborative with a lot of community serving organizations, it was really important to go out and talk to our clinical staff who may be working with these seniors, recognizing that something is off, but maybe in that short period of time when they have the appointment, not really feeling like they are able to do anything, or that they don't really have the mind flag that goes, oh, well, I should be recommending this social service or this socialization encouragement. And so we did a lot of work early on with different clinical groups and doctors' offices and clinical staff to just get them to recognize the indicators in their own practice which might tip them off that this is an issue, but also how social isolation is a health issue and something that they should be making recommendations around within their clinical practice. So it was a great opportunity to kind of meld those two catchments, services that go into the home as from a health perspective, as well as when people might go out into the community.
I think we have time for one more question. Okay, I have two here. Okay, Mary? We have three, actually, so I'll start with Mary. We'll try to take them all. Yes.
Oh, okay, hi, I'm Mary Well. I'm board member of the council, and I work for the Southside PCA. And I have a question for the smart city people. I just learned and read a bit about your application just yesterday online. I'm so excited. I think it's exciting. And so, but after listening to you, I just have my question is, the online stuff. I mean, I think we all get that, but I think in a way it's a subtle kind of ageism in that you said we'll provide hard copy, but will you provide one-on-one focus groups, face-to-face stuff for older adults who want to provide you with feedback?
Come on up. Come on up. Don't be shy.
Right. So as Katie said, we were announced as a finalist back in June, and so we've got essentially from June till March 5th next year to prepare our 75-page submission to the federal government. A big part of that is the engagement piece and qualitative focus groups. So just last week we were doing focus groups with seniors 55 to 65, 65 to 79, LGBTQ, so trying to get the diversity inclusion, just doing everything that we can, because seniors is one of our big demographics along with newcomers, and then we have the newcomers and the seniors, mixing that together as well. So we are getting that, and we're just about to get the feedback from that. I was participating in that, but we're going to roll up the final report. But just fascinating, to Katie's point, we can't just build this on, in City Hall. We have to get out there and get that feedback into our bid, because that's what the federal government's expecting as well. So I hope that answers your question, but absolutely, yes.
And more?
Yes, Anwar Hutt from Government Chat. My question for Southside PCN and other, your program, Senior Center Without Walls, seemed very exciting. This is the first time I've heard about it. Can you please a little bit educate me how really it works? Because I just couldn't comprehend, because it seems very exciting.
You're not alone. I think when we first pitch it to people, sometimes people get it right away and they're like, oh yeah, a group of people chatting it up, I'm on board. Other people are going, what on earth are you talking about? Exercise on the phone? What is going on here? And I think really what it is meeting that piece of melding together this really simple technology. You're in your home, you've got your phone, you put it on speakerphone, and you're now no longer alone. If you closed your eyes, you could pretend you're in a coffee house with your friends and you're chatting about the recipes that you made yesterday. It encourages people to take up activities. We have a creative writing group and this exercise group where they may be sitting at home alone, but there's someone on the phone going, okay, yep, you should be doing your stretches. Come on, let's do it together. We're going to count to 30 and we're all going to do it together. And even something as simple as, no, I think you're a wonderful author. Please tell me more about this poem that you wrote, or share with me this experience you've had. And really, with this platform being as open-ended as possible, we can do things that are very easy for people. A presentation from a dietitian talking about healthy cooking for one. A grief support group where you're talking with an expert about coping mechanisms or loss. Caregiver support group where you can't get out of your house. You've got someone there and you need to be there with them, but you also need some time for you. So here's this hour that's set aside with people who are in your space with a shared experience and are there to support you. So ultimately, we work very closely when people first join us to figure out where their level of comfort is. Are they ready to go and they want to chat with everyone and they're really excited? Okay, great, we'll get you all signed up. Are they a little bit more hesitant? And are they going to need some more encouragement and facilitation on the calls? All calls have a staff person on them, in addition if there's a speaker or someone else. So we try and encourage those who maybe are a little bit more quiet, maybe a little unsure of when to join in. But I'm sure everyone in this room has been on a conference call before. They are sometimes a little difficult. We try and make them a little bit more fun and a little bit more interactive and engaging, and that's really where the staff person comes in. But I think what we're really hoping to do is to get more awareness out about the program now that it's up and running Monday through Friday. We run 2 to 3 programs a day, so there's a little bit of something for everyone, and we want to make sure we're finding those that could benefit from us. So if there are any specific questions afterwards, we also do education sessions for staff. So please let me know. We'd be happy to come out and do that. But great question.
Do you do a home visit with the person? Or?
We do have the option to do home visits. In particular, if someone is a little uncertain of how to use their phone, to put it on speakerphone, or if it's working with hearing aids, we are more than happy to go out into people's homes so they can meet us and to get to know. We can do a demo right there with them to show them how the phone would work. And we're also upgrading our phone system to allow a bit more of an automated call out. So one of the great features we have is for those with memory loss or vision loss, oftentimes it's very difficult for them to type in that 1-866-5, and then you got a 7-digit passcode. We've all been there. But we can actually call them into the calls. So they just receive a quick phone call right before the program starts. They press one button and there they are in the program with everyone else.
With the Senior Centre Without Walls, do you have multi-language capabilities currently?
We are trying our best. So if anyone has a particular language category that they're interested in, we are currently looking into Punjabi and French language offerings. But basically, if there is a volunteer or an organization who is interested in helping us, because my own language capacities, I can barely speak one, so I don't know if I'm the best person for that, but I think it's about us finding the groups that are interested and able to do that. We do that with a number of programs. If somebody calls and says, I've just had a stroke and I'd love a stroke support group, sure, we'll find someone to do it. So it's the same with language, but we could really use some help from other organizations to get that one up off the ground.
Francis?
I just want to say thanks to the ESCC for having Jeff here doing the capture, because so many functions that we attend for the Canadian Hard of Hearing Association Edmonton, we find that hard of hearing people are not accessible to what is going on. And that is my question. I have a question actually for 3 of the groups. Buildings and presentations for the original program, as well as for driving happiness, and driving happiness is slightly different. For the first 2, when you consider that 3 in 5 seniors have got hearing loss, a lot of them do not attend presentations, do not get themselves involved for the simple reason hearing aids do not make it possible for them to hear everything that is going on. And if by some chance the battery runs out in their hearing aids, well, then it's just like they have nothing. So do you make, when you were doing your presentations at all of the different places, what sort of allowances are made so that you reach the whole audience and not just part of it? Because I know a lot of seniors do not attend these things because they know that they cannot, with just a general PA system, know what is going on. For Rooms Without Walls, similar type of thing. What type of allowances are made? Because you do have a lot of people that need to be able to do TTY or text messaging. Is that made accessible for them? Because to put on a speakerphone for them is not going to work.
I can take a first stab at that. So that's something that we have tried to work with different organizations to figure out what piece of technology that we need. There isn't a great one right now for the teleconferencing, and as of currently, what we do is mainly to organize and to reduce the background noise, and so it doesn't work for everyone. You're absolutely right. There are certain people, depending on the technology, that they have the phone system and their own level of hearing ability, it might not work on the phone. But we do have the ability to moderate volumes and to get rid, essentially, of all background noise other than the voice of the presenter, which we have heard from people who have identified as having some hearing loss on our phones is very helpful as compared to being in a room with lots of background noise and a presentation happening. So it's an area that's on our priority list. We are really interested in what is that technology that we need to have to make it more accessible for folks who want to use that. And it's something that we still need to work on, because while we've made some improvements to clarity and volume, that will not work for everyone. And that's something that is a gap and something we are actively looking into. But we haven't got there yet.
So you said you had a different question for me, or?
A slightly different question for you. My question for you was pertaining to, do you offer evening for driving with happiness as well? Because so many seniors, and I mean, we'll use an example of potluck dinner the other night. We had 3 that were not able to come because they don't drive at night anymore.
Absolutely. Because we run on volunteers, we don't guarantee any ride, but if we have a volunteer that will take them, we will book it. So we have taken people to the airport at 3:30 in the morning. We regularly take people to church on Sunday mornings. So we do operate as a 24/7. It's just whether or not we can find a volunteer to take that ride. And more we're starting to get professionals who work during the day who are willing to do evening and weekend rides. So that's been allowing us to expand that offering. Also, to your other point about presentations, I know when Drive Happiness does presentations, we always have a PowerPoint behind us. So at least they'll be able to get the key points, even if they're not hearing everything that I'm saying.
I was going to say, PowerPoints are wonderful, but 95% of what a person gets out of a PowerPoint is what the person presenting it says with it.
I agree completely, and so there really isn't any perfect way when you're doing a small presentation in front of a small group. I try and make sure that everyone is getting what they need out of it, but it is a real challenge, and we do have a number of riders who have hearing impairment. So that is a challenge that our drivers are trained to work with. We do work with a number of organizations. I don't know who we work with on the hearing impaired side. I know with vision impaired we work with CNIB, and we have notes in our system. So a driver knows, for example, if someone is vision impaired, that they can't just pull up to the door and go to the door and the person's going to see them with their Drive Happiness apparel and come to them. They need to physically go and find that person because they can't see that Drive Happiness is here. They need to either hear it or they need to physically have that contact. So we do try and accommodate all the different areas.
From us or the hard of hearing?
I don't think we have, but I would love to connect with you. And we do training with our drivers, so anything that you could provide our drivers with insight how to work better with the hearing impaired, we would love to do. Okay.
Thank you very much. I think if you have any more questions, our panel will be around after the program is over.